cheapest classic car insurance in California. It's estimated that 4 million Californians will get access to healthcare with the changes initiated by the Patient Protection and Affordable Care Act. You can use your annual income to see whether you'll be qualified for assistance. If you make between $14,403 and $41,000 a year, or your combined annual family income is under $73,240, you will be eligible to get health insurance plans in California through the exchange, and you can use subsidies to make it more affordable. If you don't have children and your annual income is below $14,403, or you're a parent and your annual income for a family of 3 is under $24,360, you will be eligible for Medi-Cal. Healthcare reform expands this public program to increase financial assistance to people with incomes in the low to middle range. Healthcare reform will extend coverage to more children by increasing help to families, but it also allows parents to cover their children under their California health insurance for several more years. As of September 2010, children can be protected by their parents' coverage until they become 26. In addition, healthcare reform specifically ends exclusions on pre-existing health problems. If you are one of the millions of children with a problem like asthma who have been barred from medical care for years, you'll have access to much-needed care. If you are at least 65, you will continue to get Medicare, and healthcare reform extends the viability of the Medicare for seniors in the infamous Medicare donut hole, which means Medicare does not pay for your prescriptions. Healthcare reform cuts your out-of-pocket costs for prescription drugs with a $250 rebate check in 2010. Ultimately, reform is designed to completely remove the Medicare gap in coverage for prescriptions by 2020. In September 2010, healthcare reform ends the charging for recommended preventive services so seniors can receive an annual wellness checkup for free. This can help catch health problems early when they are most treatable and reversible, and give seniors peace of mind. If you have been a legal permanent U.S. resident for less than 5 years, you will be able to buy health insurance through the exchange in 2014 and take advantage of subsidies to make it more affordable. If you have been a legal permanent resident for more than 5 years, you may be eligible for Medi-Cal in 2014. Undocumented immigrants will not be able to participate in the exchange or Medi-Cal, but healthcare reform does not block them from receiving care at health centers, hospitals, or local community clinics when they need emergency medical help. Whether you need California Family Health Insurance or California Individual Health Insurance, the exchange is mandated to be available in 2014. California may expand the Medi-Cal program before 2014. If it expands Medi-Cal to all residents with an annual income below $14,403 before 2014, the federal government may help California cover the cost. If you are a U.S. citizen or a legal resident, you will need minimal essential coverage for yourself and your dependents in 2014. You can be covered through employers' California Individual Health Insurance plans, the exchange, or Medi-Cal. American Indians, people who prove financial hardship or religious objections, those in prison, and undocumented immigrants do not have to purchase health insurance. All others will have to pay a tax penalty of $95 in 2014 if you decide not to get health insurance. If you are still not covered with health insurance in 2016, that penalty will have grown to $695. It's estimated that 8.2 million are now without health insurance in California. Healthcare reform is expected to extend coverage to an estimated 4 million. What about the other 4.2 million people? They are believed to be mostly undocumented immigrants who will not participate in the extended coverage.